everyone. My name is Ramona Bhatia, and I am currently an HIV consultant working for the US CDC in Atlanta, formerly with US CDC in Vietnam. On behalf of my incredible colleagues, including the Vietnam Administration for HIV and AIDS Control, community partners at the Vietnam Network of People Living with HIV, Lighthouse, and others, implementing partners at the Partnership for Health Advancement in Vietnam and Lab Saigon, and of course, my incredible team at CDC PEPFAR Vietnam, I'm going to talk to you today about implementing a status-neutral approach in Vietnam, one of the first Asian countries to do so, and provide lessons learned. So hopefully you can help implement status-neutral in your setting. First, some background. Recently, UNAIDS issued a stark warning that our HIV response is in danger. But the truth is, we already have the tools to end the epidemic in hand. Biomedical prevention with treatment as prevention, or U=U, and PrEP are the most effective ways to prevent new HIV infections. U=U, that is people living with HIV, taking ART and achieving viral load suppression, is 100% effective at preventing sexual transmission of HIV. And we also know that PrEP is 99% effective. These work synergistically to achieve epidemic control. That being said, the most widely used HIV cascades are limited to diagnosis, ART initiation, and viral load suppression. There is a need to reconceptualize the HIV cascade to embrace new innovations in biomedical prevention, including PrEP. Recognizing this, in 2018, New York City proposed the status-neutral model for HIV engagement, as you can see in this slide. As you see at the top, the model emphasizes that HIV testing itself, as opposed to diagnosis, is the initial gateway to prevention and care. Different from a linear cascade that distinguishes care based on positive HIV status, the status-neutral model is cyclical, with continuous engagement for both people living with HIV, they're on the right, and those on PrEP or at risk, they're on the left. The same comprehensive services, like STI prevention, are offered regardless of status, embracing whole-of-person care. New York City successfully applied the approach through extensive programming, including communication campaigns and rebranding their public STI clinics into sexual health clinics, thereby eliminating the social and clinical HIV divide. According to the experience in New York City, normalizing both treatment and prevention served to destigmatize both. Since then, status neutral has been recommended at the national level by US CDC. In addition, other countries like Australia have developed their own comprehensive status neutral messaging. Recently, the draft PEPFAR 5-year strategy has called for scale-up of status-neutral approaches for services for the very first time. However, examples of status-neutral implementation in low and middle-income countries are quite limited. In Vietnam, we have been long recognized internationally for our work in U=U since 2018. To date, millions of people have been reached on social media with our U=U messaging, or K=K as it's called in Vietnamese. Now, during this time, PrEP scale-up really began in earnest in Vietnam with ambitious targets. In addition, preliminary analyses from the Stigma Index study in Vietnam showed high rates of anticipated, experienced, and self-stigma. To support PrEP service delivery and to combat stigma, we began to explore how to contextualize and implement a status-neutral approach in Vietnam, using lessons learned from successful K=K programming. One key strategy was having a diverse team at the table. It was incredibly critical for community to be engaged from the very beginning to ensure the status-neutral initiative was meeting their needs. Public health officials continued to provide overarching leadership and endorsement. And like K=K, we collaborated with the private sector to ensure health messaging products were professional and polished. Through this multi-sector collaboration, we developed the Love is Hard HIV Prevention is Easy campaign. This contrasted the difficulties of love with the relative ease, safety, and effectiveness of biomedical prevention, including K=K and PrEP. The message fosters the idea that with safe and effective medicine to prevent HIV transmission, there is no reason to fear knowing one's status. We really wanted to celebrate that we live in a time where HIV status does not matter when it comes to relationships, love, and healthcare. Importantly, the campaign calls for person-centered as opposed to HIV status-focused healthcare, emphasizing access to safe and effective ARVs to stay healthy and prevent transmission, and normalization of routine HIV testing. To operationalize a status-neutral concept in Vietnam, we opened 13 one-stop shops, providing comprehensive sexual health care for MSM, from testing to biomedical prevention to chemsex and mental health counseling, and more. In anticipation of World AIDS Day 2021, our social media campaign kicked off last November with a new logo uniting PrEP, K=K, and Zero HIV, as you see on the left of the slide, as well as sex-positive visuals, including short videos highlighting diverse couples, including LGBTIQ couples. Importantly, health information on K=K, PrEP, and where to access care were an integral part of the message. In the first 4 weeks, our Facebook page reached 11 million people with 57 million views, representing 15% of Vietnam's total social media users and 11% of Vietnam's total population. Moreover, 42% of those reached were young, between 18 and 24 years old, and 57% were male. This is our target population experiencing the highest rates of new HIV in Vietnam. To further reach young men who have sex with other men, we also collaborated with Blued, an online dating app popular with the MSM community in Vietnam. We were able to reach 2.3 million on the Blued app with our campaign message. Love is Hard was formally launched on World AIDS Day 2021 at an art exhibition called the Museum of Heartbreak. Incorporating feedback from the community, it was important for us to use art as a medium to demedicalize the message and make it more accessible. The exhibition featured creative works by 10 Vietnamese artists who were tasked to interpret heartbreak with the subtext of HIV prevention and combating stigma. Pieces included poetry, contemporary dance, artistic installations, photography, 3D installations, and more. Moreover, recognizing the popularity of Vietnamese rap and pop with young people, we were able to engage a well-known Vietnamese singer and LGBTIQ ally called Camise, who, with Mike Pham, created a track specifically for the Love is Hard campaign, inspired by nearly 1,100 real stories about heartbreak that were contributed to our campaign. The song, about two people who meet, fall in love, and break up, was performed live for the very first time at the exhibition launch. Here's a clip of the music video with 1 million views to date. In addition, at the launch, there were nearly 1,000 attendees in person over 2 days, with 888,000 reached and 1.4 million views on social media. This includes over 16 major influencers who engaged. Since the campaign, we've had multiple positive signals through social media testimonials and community consultations indicating positive reception and outcomes. In addition, in our first community event where experts were able to explain status neutral, we had over 23,000 views on the live stream. Importantly, there's evidence suggesting that the campaign led to changes in health knowledge and health-seeking behavior. A brand lift exercise measuring impact of the Facebook campaign showed outstanding results, with higher HIV knowledge transfer amongst exposed groups versus controls, and nearly 500 people used our chatbot for information on how to access care. And since March 2022, Our one-stop shop clinics providing comprehensive care for MSM, regardless of HIV status, have provided PrEP to well over 6,000 clients. We are proud that the Love is Hard campaign has gone on to win Marketing Interactive's PR Awards 2022 Gold Award for Best Healthcare and Pharmaceutical Intervention. In addition, we've also been shortlisted for PR Awards Asia 2022 for Best Public Sector Campaign. So, what are some key considerations from the Vietnam experience as you think about implementing a status-neutral approach in your setting? The first is the critical role of the community. Like K equals K, Love is Hard was community-driven in Vietnam. This is important to contextualize status-neutral for different populations, cultures, and locations. For example, status-neutral programs that work in KP or key population-driven epidemics like the US and Vietnam may not work in all types of epidemics. So it's important to work with the community to find out really what will work. Indeed, given the new PEPFAR call for status-neutral scale-up, it will be important to grow models for generalized epidemics and subpopulations of youth, heterosexual men, and adolescent girls and young women in other low and middle-income countries. The second consideration is it could also often be challenging managing siloed HIV prevention and HIV treatment funding streams and resources to accomplish a status-neutral, comprehensive service delivery model. Government endorsement of the status-neutral approach in Vietnam was important to facilitate coordination of these different resources to make one-stop shops a reality. Finally, it's important to think about evaluating the impact of the status-neutral model. As mentioned, we have had multiple signals indicating positive effects of the campaign. We are currently working on understanding the impact of status-neutral implementation via Love is Hard and one-stop shops on stigma, service uptake, and ultimately progress to epidemic control in Vietnam. With ongoing recognition of the importance of person-centered programming and biomedical prevention, the status-neutral approach is of increasing relevance. We hope our experience in Vietnam has encouraged you to think about how you can be a champion for this movement to combat stigma and normalize HIV testing, treatment, and prevention in your work. I'd like to leave you with the full Love is Hard video to inspire your adoption of this important message. Thank you for your attention.